Down slow. Down slow. Stop. Get the basket under. Down slow. Down slow. Come on out. Down slow. Down slow. Get the haul off of her.
Get off. Doing okay. Can you hear me? You guys got ropes right behind that. Still breathing?
The rest of the team members are breaking down the equipment and checking it for reuse.
Stop. Now count.
Hips and pelvis. Stable. Left leg. Clear. Pulse.
The team is working at lashing the second patient into the basket. Each team has a rope log that they maintain use of the number of times and the use that each rope was used in. They will fill the rope log out and turn it in to the judges to where the judges will know that they did use certain ropes and what they were used for. Second patient is now delivered to the first aid station. The medic will check, do a survey over, make sure the patient's conditions hadn't changed. All interventions remain the same, and at that point in time they'll remove the patient, turn them over to the first aid station.
Pulse. Good pulse. Hand. Cap refill.
Less than 2.
Medical alert tag.
No medical alert tag.
Checking this arm. Clear. Pulse.
Team members checking the equipment bag, trying to get it as orderly as possible. Just make sure they have all their equipment. They hadn't left anything hanging, and they'll take it all back to the original location that they started in, and then there'll be a wrap up with the team captain just accounting for all his personnel, make sure everybody's there, make sure everybody is healthy, and all the equipment is returned. At that point in time, he'll make a return over to the judge and make his team available to assist any other teams in the area that might need assistance.
One, no injuries. 17-year-old female delivered to the first aid station, climbed up ladder, fell, hurt her right knee. She was ANO ×3 at the time of delivery.
2 no injuries. Barricade's been taken up.
3 no injuries. Our equipment's inspected, ready for reuse. This first structure right here has been recon, marked, searched by Cedar Biorescue.
4 no injuries is a rope log. We had minimal rope exposures, Captain. No damage to the rope. All of their equipment's been inspected and put back to the starting location. All SCBA models have been inspected. They need to be recharged. The masks need to be cleaned and re-bagged for later use.
5 no injuries. Barricade has been pulled. Captain 6 has no injuries. Delivered 1 female patient, unknown name, unknown age. Found her in a tunnel, unconscious, unresponsive. No medical alert tags. Treated for shock.
Structure has been marked. Search and Biorescue.
Yes.
Marked. 7 no injuries. Judge, we had 1 patient, unconscious, unresponsive. We did a tripod raise, packed the patient in stowage basket, delivered to the aid station. We had the first patient was extracted, had injuries to her right knee. We did a raise, overhead change of direction raise, packaged in stowage basket, delivered her to the aid station. ANO ×3. Here's my captain's log. Here's our rope log. We did have minimal rope loss noted just from normal wear and tear on the rope. All my rescues were accounted for with no injuries. All your equipment's been inspected, ready for reuse. All of our equipment's been inspected for reuse. The SCBA's need to be recharged and be cleaned. All the structures have been marked, searched by Cedar Biorescue. All the barricades have been removed. Anything else, guys? We're now ready to assist anybody and they need our assistance.
Good job, guys.
All slow.
All slow.
She was unconscious, unresponsive, so we found no injuries on the patient. So we extracted the patient, placed her in the Inferno basket, packed her in there, and delivered her to the aid station. It went fairly smooth. I think it was like 33 minutes total from start to finish with both patients. And originally we had 1 man go in on breathing air, so I had a backup station with breathing air. He needed assistance to be able to move the patient to where he can get her underneath the tripod. So I sent the second guy in on breathing air, and I had 2 other men on breathing air ready to go in if we needed to assist him out of the hole. Once he got the patient moved over, we brought one of our rescuers out. We had visual contact at all times with our rescuer in the hole. So we was able to verbal and visual contact. Once the first rescuer come out on breathing air, we was able to take the breathing air off.
In the second of a three-part series, we cover another IRECA scenario, this time focusing on a high-angle rescue at an industrial facility. We're going to compress our coverage of the beginning of the scenario to give us more time to examine the conclusion.
Be careful with your equipment. Take care of your equipment.
The team started well, reminding each other about safety procedures, locating the patient, and establishing psychological support between the patient and a paramedic.
Jacob, can you hear me? My name's Carol. I'm going to be down there in a few minutes.
She briefly assesses the patient's condition as best she can determine it from her position above.
Sir, we do observe a small cut on the forehead. That's correct.
The team rigs a Hall system and lowers the paramedic into the space.
Can you hear me? Lower slow. See you breathing all right. Be careful. Take good care of you.
Followed by a second rescuer to assist. A Stokes basket is eventually lowered into the space.
Careful, run around. Got the tag line ready? Coming down.
Assessment of the patient continues.
Captain!
Yes.
Still got a Cat 1 patient. Unconscious, unresponsive.
Okay.
Small cuts to the forehead, controlled bleeding. No other information at this time.
Okay. I've got a butterfly coming down from the basket. Bill, Joe, y'all okay? Yeah. All right.
Safely around the patient. Jacob, we're going to have you out here in a few minutes.
The patient is packaged and diamond lashed into the Stokes. The Hall team re-rigs their mechanical advantage. At this point, there are approximately 20 minutes left. Now, let's watch the rest of the scenario, observing the significant events. Arnold Pena, lead instructor of American Emergency Response Training, an on-site industrial training organization, gives us a hand with the analysis.
The environment here is in a typical industrial application. The team is working around some catwalks. They're also working around a lot of industrial handrail. Industrial handrail always brings up a little bit of controversy when you do anchoring, rigging, and vertical work. There's a nice depiction of these guys kind of test out their anchors. The handrail we're looking at right there is probably not one of the more suitable handrails, but it just so happens the deck here that they show does have a nice continuously welded steel handrail. And this is where the majority of the rigging is taking place. The safety line system is running with the yellow rope, and the main line system is running on the blue rope. This is some edge protection coming out. Looks like the guys up on top have called for. Patient's already rigged up in a Stokes basket. This was a nice three-person test, kind of a tug-of-war little test when you have what's called a questionable anchor, and a handrail's kind of fall in that category. So a good three-person tug like that kind of reassures the team leader and the rest of the team that the one person that's going to be hoisted should substantially hold that load. This final bit of rigging, it looks like the hoisting mechanism or the hoisting process is going to be done by a piggyback haul system. The blue rope changes direction right directly behind this set of rigging and goes on back 90 degrees from the handrail, and look like they might have got about a 15-foot stroke. They're hanging an anchor strap, it looks like, with a carabiner and a rescue cinder or a mechanical cam type device on the blue rope, and that's going to be their progress capture for the haul. Interesting approach, putting the rescue cinder over the edge like this, but it does definitely get it out of the way of the haul team. And again, I think something that happens on catwalks, you don't have a whole lot of space to work.
They've got the yellow line. Don't move the yellow.
The main line hasn't been attached to the bridle yet. They're retrieving it at this point to send down a piece of rope to make a lifting bridle for the Stokes basket. The initial entry crew did take a rope with them to do the initial lashing, and it looks like they're going to pick up a lifting bridle at this point. Kind of interesting about this is a piece of pre-cut cordage come down that this team is evidently keeps in their bag, and they're going to hand tie a bridle, which is something that a lot of teams don't do anymore. But it definitely shows their skill, if the ability to do that quickly and tie some neat knots and come up with a symmetrical system. We'll see during the lift here that they do a real nice job of of getting a head-up position on that Stokes
Patient.
basket.
Watch the ropes over your patient.
Looks like maybe 20 or 30 foot cord.
Everybody work safe. Take care of your equipment. Watch your patient.
Sir, what do you want me to do, sir?
Communication's been outstanding with these guys. You can hear them kind of barking out the commands in a loud vocal voice, and then at the same time you're getting a reoccurrence of that. Whoever receives the command, they're making sure they copy that order. So very, very wonderful communications. Everybody should strive to be this good.
Centering. And raise. Raise the center. Forward, Captain.
All right, so the bridle's been put in place. It's a 4-point bridle. You can notice that where the blue line, the main line attaches, is well over the center torso of the body, which is going to give them that good center of gravity, and that's going to give them that head-up position during the lift process. Everybody's assuming their positions up here on top. The safety line's being manned. It looks to be a munter hitch coming off the far side of the handrail, and again, the piggyback system is going to be doing the lift. The hoisting process, something that we see here, just a little bit of jumpiness in the hoisting process, but again, that's very typical with a manual lift. And this piggyback system, it'll show in just a minute, I think it's being operated by one person, a 4-to-1 mechanical advantage. It looks like a pretty medium-sized person. The pause that you saw is probably a reset in that system. One of the big pros they got by hanging the mechanical advantage, the progress capture device over the edge, you saw not really any drop per se during that reset process. So when they came to a stop, the patient was static, and here they are slacking and resetting the system. And again, the short area they have to work by working on a catwalk like that, and they might have achieved, looks like about 12 or 15 foot of stroke in this piggyback system. So that's what they get per lift. And the lift just exceeds that by just a little bit, so it looks like maybe one reset. There's one gentleman on the Hall team hitting that 4-to-1, but he's able to raise this load. It works out. It's really hard to get super smooth with that, but that's totally within the realms.
You need more, right? People have to come up high. Slow. He's only got about 3 feet.
The high point rigging occurred, looks like maybe 6 or 8 feet, maybe 10 feet above the initial platform they looked to land the patient on, so it worked out really nice. It would be extremely difficult to get this patient up and over the handrail, something that's hard to do with Stokes basket work, but when you can rig a high point, bring the patient into a level down below, it works out really nice. They're working to transfer the system over to a lower. More than likely, they've reset their piggyback. Instead of grabbing and pulling up, they've reset it short so they can now use the mechanical advantage to lower the load. Person at the edge is activating the progress capture device to let release, and the safety system follows it down. Unique thing to a munter hitch is the munter hitch functions both ways real easily. And here's their landing on the deck. Good communication here, especially with these guys called out some increments so that the top crew knew exactly how far they were off the floor. They can tell when the ropes hit the bottom, and then these guys can immediately call for slack so that they can break these ropes loose. Notice the patient does have, looks like their head's been secured, and they have provided some eye protection for them. I think this is a really important thing to do when you're handling the ropes around these people. Everybody knows that most of the ropes are cut by a hot knife, which leaves a kind of a hot plastic sharp ends on the end of the rope, so that's a nice protection. Both rescuers now are put right back on the same system, main line, safety line. Got a little help on the Hall team, it looks like now. And the rescuers are being hauled out. Something that this depicts really nicely is that yellow safety rope. Every team in the world across the country is going to try to really strive to keep these lines as tight as possible. That's the whole idea of running a 2-rope system, is that you have redundancy. So about 6 to 10 inches is the common thing that we try to strive for that. So you see that little bit of give, but that's the give and take. The team leader should have a close eye on that, and would be a showstopper to call stopping that operation if he sees excessive slack build up on that line. A little bit more weight on the rope this time. These guys actually are coming all the way back up to the original level, so they're not pendulum over where the Stokes basket landed. The rescuers are going all the way back up. Fortunately, these rescuers are conscious, alert, and oriented, and they're able to do a little climbing here on their own. Trying to break that 90-degree edge with a dead load like the Stokes is a little bit of work. It can be kind of rough. Works out nice for these guys. Here comes the initial rescuer. I think this was the paramedic that made initial contact. First one in, last one out.